The World Health Organization has urged wealthier nations to ensure equal access to vaccines for poorer countries. WHO Chief Tedros Adhanom Ghebreyesus says the pandemic will end when the world chooses to end it. He was speaking at a summit of global health industry leaders here in Berlin, aimed at speeding up the world's response to the pandemic. The take-up and availability of vaccines is especially low in Africa. As the global death toll from COVID-19 approaches 5 million, health experts agree that countries must work together. They fear that vaccine nationalism can only prolong the pandemic.
The size and scale of the COVID-19 pandemic makes it a 1-in-100-year event. Not since Spanish flu killed more than 50 million people at the beginning of the 20th century has the world seen anything like it. Today, nearly 5 million people have died from the coronavirus. Almost 50% of the world's population has received at least one dose of a vaccine, but for low-income countries, that figure drops to below 3%.
I'm afraid that the world is in danger of moving on too quickly, not learning the lessons, and not making the reforms that are necessary in order to be better prepared for the next pandemic or other challenges the world will face. And I hope I'm wrong in that. But I do see signs of countries moving on already and going back to business as usual and a more nationalistic agenda. And I would sincerely regret that. It would be an amazingly stupid thing to do.
The World Health Organization warns vaccine nationalism will prolong the pandemic and leaves the world's poorest and most vulnerable people at risk. Britain, for example, has now vaccinated 71% of its population. It ended its COVID restrictions in July. Contrast to that, Ethiopia, which has jabbed just 2.6% of its population. But vaccines are just one part of the picture.
Every country needs to learn the lesson that you need to invest in public health and you need to ensure that you have the capacity to respond and prevent and respond to these crises. So it's a lesson for the rich world as well as the world, the lower middle income countries. And then I do think there is a responsibility for the world to work together. Yes, I do believe that the rich world has got to do more to continue to support vaccine manufacturing in a distributed way, to support public health infrastructure across the world.
Scientists say we're entering an age of pandemics. So many will be hoping the lessons from COVID-19 are taken on board sooner rather than later.
Sabine Kamper is managing director and co-founder of Open Consultants. She's a leading expert on global health, organizational development, and government affairs. She also chaired a panel at the World Health Summit here in Berlin. Welcome to DW, Sabine. What are the lessons we have learned or not learned from the COVID-19 pandemic?
Thank you so much. Yeah, let me start by sharing maybe 3 lessons that really stood out to me. First of all, we have to understand that the pandemic is not over yet, right? And we cannot forget. The pandemic is really unprecedented, and so we have to be prepared for the next one. The next one will surely happen, and we have to be ready at all times. That's the first one. Second, funding is critical. So we can develop new health technologies, new health products very fast if there is investment. And also the pandemic has shown, that many of the new vaccines developed, they really could only be developed because there had been investment in platform technologies many, many years ago. So we need to invest. And third, I think what has been highlighted also in the panel I chaired is that collaboration is really critical. So we have to make sure that the public and private sector work together to address these health challenges.
Okay, you speak of cooperation, Sabine, but leaders throughout the pandemic have called for a global response as the virus knows no borders and so on. But has the response been global?
Yes, to some extent. I think after the Ebola pandemic, the world has become much more aware, right, of pandemic threats, of global health security. And for example, one initiative that was founded in response to the Ebola pandemic was the Coalition for Epidemic Preparedness and Innovations that funds the systematic study of vaccines. And then after the COVID pandemic started, a number of important institutions were formed, including, of course, most importantly, ACT-A, which is the Access to COVID-19 Tools Accelerator, a new form of collaboration that to basically accelerate the development, production, and equitable access to new tools. It involves many organizations from the private, the public sector, and it also was recently reviewed. And yes, it's not perfect, but it did make an important contribution to the response. And one pillar of that is COVAX, which is responsible for the distribution of vaccines.
And tell me,
overall.
Yeah. Go ahead.
I think overall, it's clear that the system was and is not ready, right? So we have now vaccines, but this has come rather as a surprise. So it was by chance or coincidence, not by design. And we have seen a lot of selfish behavior by countries. And the system was certainly not ready at the beginning.
Well, I want to ask you about that. Yeah, if I can,
Yeah.
about vaccine nationalism, because the Secretary General of the United Nations, Antonio Guterres, has been condemning this vaccine nationalism. Is that a fair assessment?
I think so. As you highlighted also in your little film, Africa is approaching a vaccine coverage of 5%, while northern countries have a coverage of 70 to 80%. So that gap speaks for itself. So despite the promises countries made, right, for equitable access, we have seen vaccine nationalism everywhere. So it will be very important to strengthen COVAX, which is the world mechanism, right, for equitable distribution. And I also wanted to highlight, not only talking about vaccines, right, we also need fair distribution of new drugs and diagnostics. That's very important too.
All right. Thank you so much for that. Sabine Kompe, the Managing Director and co-founder of Open Consultants.
Thank you.